Welcome to ClearScript's Leveraging Therapy Management in Your Health Plan webinar. We're glad you could join us today. Fairview Specialty Pharmacy's Ann McNamara, Vice President of Strategic Clinical Development, and ClearScript's Nicole Christian, VP of Clinical Account Services, will be giving insight into Fairview and ClearScript's approach to therapy management. They will share how collaborative and strategic patient-centered care is improving adherence, reducing waste, and optimizing outcomes. My name is Randy Skirka. I'm the Vice President of Sales for ClearScript's PBM. Before we turn it over to Ann and Nicole, I want to share a little bit about ClearScript's. We're a pharmacy benefit management focused on delivering smarter, more personalized pharmacy solutions, and our partnership with Fairview Specialty Pharmacy is a key part of how we achieve that. Together, we bring clinically driven support to members with complex conditions, ensuring cost-effective care and better health outcomes. This collaboration allows us to go beyond standard PBM operations and engage at the patient and provider level with thoughtful care, planning, and impact. Before they begin, I'd like to introduce our speakers. Ann McNamara is teaming up with, Ann will go, has been with Fairview Pharmacy Services since 2000 and is responsible for the direction and development of clinical programs such as therapy management, physicians engagement, trend management strategies, pharmacist counseling, and adherence initiatives. She was responsible for drug pipeline, surveillance for strategic purposes, and strategic with player to develop programs and services that improve care or reduce costs, and also works with the analytical department to develop clinical reports and demonstrate outcomes for our clients. Previously, Ann worked at Express Scripts and developed programs for prior authorization, drug and therapeutic therapy, and so on, and care management. VP of Clinical Accounts Services, Nicole, leads ClearScript's clinical team, overseeing the strategic development and direction of clinical programs and services. She and her team work closely with clients to develop practical, result-driven solutions and balance financial performance with high-quality member care. She has been a practicing pharmacist for 18 years and with ClearScript since 2016. She brings a wealth of experience across multiple pharmacy settings, including retail, hospital, discharge, long-term care, pediatrics, and compounding pharmacy. Nicole's experience in both health systems and chain retail pharmacy environments gives her a well-rounded perspective on the pharmacy landscape and allows her to offer unique insight to help clients navigate complex pharmacy benefit challenges. Now, I'm going to turn it over to Ann and Nicole. Take it away, ladies.
Thank you for the introduction, Randy. Today, I'd like to introduce the concept of seamless synergy, our collaborative model between Fairview Specialty Pharmacy and ClearScript that blends personalized, high-touch care with population-based strategies. At the heart of this synergy is our commitment to meeting members where they are. Whether it's a live call, a quick text through our Fairview Link platform, we tailor communication to each of our members' preferences, starting from day one during their onboarding with a new prescription through our pharmacy. This approach builds trust, it drives engagement with the members, and ultimately leads to better outcomes. Our collaborative teams are trained to connect with empathy, and for members who speak different languages other than English, we have a robust interpreter services as well, so nothing gets lost in translation. While ClearScript focuses on the scalability of these things, the cost effectiveness of programs, the Fairview Specialty addresses those unique needs of the individuals in the complex conditions. So together with both services, with ClearScript and our Fairview Specialty Pharmacy, we created a model that's not only efficient, but it's deeply human. It allows us to connect with our patients. And today you'll see that synergy in action as we move through the next few slides. So I'll introduce Ann McNamara, and she can take it away and dive into our topics.
Go right to the next slide. Oh, good afternoon. So today I'll provide a brief overview of Fairview's approach to specialty pharmacy management. Our success is really rooted in a patient-first philosophy, delivering high-quality, efficient services tailored to how patients prefer to engage. I will outline our high-level strategy and emphasize the importance of navigating complexity in the space. To illustrate our model, I'll highlight 3 distinct disease states, demonstrate how we improve patient outcomes, and tackle issues related to waste and cost management. As Nicole mentioned, our model really complements ClearScript's population-based clinical management programs, creating a synergy between personalized care and population-based health. The overall process starts with cross-functional collaboration and strong planning, with the goal really to decrease cost, avoid waste, improve outcomes, measure and report results, and increase member satisfaction. Successful cost-reducing biosimilar transitions or site of care programs require strong patient and provider engagement, as well as reporting and monitoring at the specialty pharmacy. So as an example, when specialty pharmacy medications or when specialty asthma medications were initially approved, they required healthcare provider administrations. Then the prefilled syringes came out and asthma medications were approved for self-administration. Fairview developed a plan working with our provider to moving appropriate patients to self-administered. We ensured patients were comfortable injecting. We worked with patients to set goals. We monitored results using a disease activity measure called the X score, and we monitored adherence. Because these medications prevent patients from showing up in the ER because of asthma exacerbations, when patients had low adherence or were not achieving their goals, our pharmacists intervened. PBMs may develop some services and put edits in the system and call it their program. I just really want to highlight success of their program are dependent upon the high-touch services of the specialty pharmacy. We do collaborate with the PBMs when edits don't work, or there are other barriers that impair or reduce efficiency, such as requiring a PA to move to self-administered. On the next slide, For Fairview's specialty pharmacy's entire book of business, we participate in a national benchmark survey administered by the MMIT Network Solutions. You all know that's probably the key metric from the survey is called the Net Promoter Score, or NPS. NPS is a cross-industry standard index that measures the willingness of customers to recommend a company's services to others. It's used to gauge the customer's overall satisfaction with a company's service, overall satisfaction with the company's service and loyalty to the brand. When evaluating NPS, a score between 30 and 70 is considered excellent, and Fairview's most recent score was 93. This means that Fairview is a leader in customer experience and can be described as world-class. Why is that important for this? We simply cannot engage and provide the clinical programs and services we provide without strong patient engagement. Patients engage if you provide valuable, quality, and efficient services. The next slide is just quickly want to highlight that this score was not just a one-time score. Fairview consistently has world-class scores with an average of 89. An effective way to strengthen member engagement is by simplifying access to our pharmacy services and ensuring timely medication delivery. We empower members to communicate through their preferred method, whether it's by phone, email, in person, or through our secure online portal called Fairview Link. What is Fairview Link? It is a personalized, secure, web-based platform that allows members to perform various tasks, including order medications and supplies, access to clinical information, or communicating directly with our team. A valuable feature of the Fairview link relevant for this presentation is our ability to prompt members to complete clinical surveys such as RAPID-3 before speaking with a pharmacist. By gathering key health insight in advance, our pharmacists can focus the conversation and provide more meaningful, efficient support during each call. So Fairview Specialty Pharmacy has comprehensive service to support patients, to ensure patients are set up for success, as well as ensure ongoing success. To prepare patients for success, our pharmacists perform drug utilization review, provide extensive counseling. Our patient financial advocates perform insurance verification and find solutions to members' financial burden. And our therapy management clinicians check in with the first month to assess if the members started therapy, are having any side effects, or if they have other needs or questions. To ensure ongoing success, our clinicians provide ongoing support and assessment. The goal is to ensure patients are safe and obtain the most value from their specialty therapy. Clinicians use disease-specific assessments to ensure patients are meeting treatment goals and intervene when they're not. In terms of adherence, we monitor refills and proportion of day covered reports to ensure they're adherent and reach out to the member or provider when there's signs of non-adherence. In some cases, delayed refills or low PDCs may be a sign of other clinical issues. And then finally, our health coach services provide holistic support for patients with unmet needs, addressing complex health and social issues. I'll quickly highlight this service on the next page. So our health coach has been able to have a profound effect on many patients struggling with grief, a new diagnosis, mental health, smoke cessation, considering palliative hospice services, and unmet needs. Our health coach supports patients with these situations by providing tools, support, counseling, or referring them to community or other healthcare resources. Our health coach program delivers. The patient survey results demonstrated that 85% reported that they agreed or strongly agreed that the health coach positively impacted their physical health. 97% reported that they agree or strongly agreed that the health coach positively impacted their mental health, and 100% agreed or strongly agreed that were satisfied with their health coach program. This health coach program supports really a small subset of our overall population, but I can tell you that the patient cases are extremely impactful, and this program could be a full topic in itself. So Fairview provides high-touch services to specialty patients and higher-touch services for those that have additional complexity. In general, each therapy disease state have a different level of complexity. It can be argued, for example, that patients with hemophilia or cystic fibrosis have more complexity than members with psoriasis. However, every patient has a unique story and situation, and Fairview provides those individualized services to support them. For example, the touch points may vary indirectly because of age. With young children, we're talking to parents who are often generally on top of their child's care. When members turn 18 to 27, they may feel invincible, struggle with adherence, and are learning to be independent. As members age, they may struggle with cognition, forgetfulness, and often have additional comorbidities. In general, a patient new to therapy has more touch points than a stable patient who's adherent and has been on therapy for many years. However, if a patient's disease progresses or relapses, the clinician identifies non-adherence and our team may increase their touch points. So the next series of slides presents more details specifically around 3 specific disease states. Starting with rheumatoid arthritis. We all know that medications for rheumatoid arthritis prevent joint damage, reduce disability, improve pain, improve global function, and improve overall quality of life. However, adherence to these regimens can be challenging, and at best, the first specialty medications works in about 2 out of 3 patients. And that is really if you use a low bar of an ACR 20. In addition, rheumatoid arthritis is relapsing and progressive. Our therapy management program is designed to improve adherence and safety. In addition, our program assists in achieving treatment goals and maximizing long-term benefits, as well as avoid ineffective medications through the use of a Rapid 3 assessment. Rapid 3 is a patient-reported validated survey recommended by the American College of Rheumatology, and I'll provide an example on the next page. So for your reference, we've included the sample Rapid 3. This is a validated survey that consists of 12 questions that address function, pain, and patient overall global assessment of their disease. It's scored 0 to 30, and the result is categorized as near remission, low disease, moderate disease activity, and high disease activity. 0 to 3 representing near remission, and 12 and higher is considered high disease. This example represents the results of a patient with strong results. You can see they've improved in every aspect of the Rapid 3. Overall, her disease activity went from high, a score of 20, to low, a score of 5. In cases where we do not see these strong results, our pharmacists provide further assessment for the reason for high or increasing disease activity. In some cases, there really could be valid confounding factors, such as increased physical activity, advancing disease, or weather affecting pain or function. However, when it appears that the member is not obtaining value from their medication, our pharmacist encourages the patient to have the discussion with their provider, or the pharmacist will intervene directly with the provider. Ultimately, this prevents waste from keeping patients on ineffective medications. For atopic dermatitis, the second disease here, we do know that specialty medications work really well for atopic dermatitis. When patients start specialty medications, they report a significant improvement in quality of life and itch. Depending upon the locations, including such as the hands and the feet, they may report improvement in function as well. They also work for comorbid conditions such as asthma or nasal polyps. The challenge really for this disease state is for payers is providing cost-effective therapy for atopic dermatitis. Atopic dermatitis presents from mild to very severe disease. The patients that our pharmacists talk to are not really the ones that you see in the commercial, though. Not the ones with the little patches on their of eczema on their elbow, or the ones that don't look good in their bikini. Our patients report bleeding, itching, weeping, or severe itch, or large or sensitive areas of the body. Given the high cost and potentially large population, it is important that these medications be reserved for refractory or moderate severe disease. For that reason, our pharmacists talk with patients up front to ensure drug appropriate, are specialty medications really needed. Our team ensures patients have sufficient but not excessive quantities on hand. And finally, our pharmacists help patients meet their treatment goals. Through clinical assessments, our pharmacists encourage patients to have discussions with their provider. And again, if the drugs aren't working or the patients aren't meeting their goal, they reach out to the provider. So similar to the Rapid 3, if you want to go to the next slide, we utilize what we call the POEM quality of life assessment, patient-reported itch severity, and body surface area involvement to measure clinical outcomes both at the individual and the population level. The results demonstrate aggregate impact, but also guide personalized care for each member. The charts included in this slide reflect the population level outcomes. The top 3 present sample data from our atopic dermatitis clinical initial assessments. So patients frequently report moderate to severe POEM scores, significant body surface area involvement, and or high itch intensity. Nearly all of our patients report at least one of these indicators at a moderate to severe level, supporting the need for specialty therapy. The lower bar charts, the lower bar chart highlights the clinical value of specialty medications in our pharmacy services. Among patients with at least 2 documented assessments, 72% reported near remission or low disease activity on their most recent evaluation, compared to 18% at baseline. Again, these quality of life measures enable clinicians to collaborate with patients and set personalized treatment goals while helping to ensure that individuals are not maintained on ineffective or unnecessary medications. When a patient's data suggests limited benefit from current therapy, our pharmacists either encourage a conversation between the patient and provider or initiate direct clinical outreach to the provider itself. Third disease state that we're going to talk about is, or the therapy category is oral oncology. We all know that oral oncology medications improve survival or diminish disease progression. Unfortunately, medications for cancer cause side effects. And it's not really if, but it is when or how severe the side effects are. Cancer regimens are expensive and complex. Regimens may include multiple strengths or changing doses. The oral medications may need to be taken cyclically or coordinated with IV chemotherapy. This complexity can increase the risk of taking incorrectly. We use board-certified pharmacists in oncology who work closely with patients taking these medications in the home to ensure that patients are taking correctly and are adherent. We provide instruction on the expected side effects. We monitor for side effects and use standard definitions called the common terminology criteria for adverse events for consistently grading. Mild is grade 1, grade 4 would be considered life-threatening. And then we intervene appropriately based on the side effect and the grade. In terms of waste management and cost savings that's in the area, we report savings for generic conversions and our inventory management process. Of note, Fairview has a strict inventory management process. Pharmacists identify situations where the member has an upcoming medical or lab appointment, and result may change the drug or the dose. In those situations, we dispense only enough days supply to make it through the appointment. With each cycle refill, we confirm inventory on hand and dispense only enough to complete the cycle. This slide simply illustrates 2 points. Number one, going on to the next one, side effects are common, and 2, sample side effect grading. So on the upper right is a screenshot of a package insert from Verzenio. This is one of the most common cancer medications that we dispense in our pharmacy. And you can see that 84% of patients reported diarrhea, 51% reported infections, and 41% reported fatigue. On the bottom is an example of how our pharmacists grade side effects from 1 mild stage to grade 4 life-threatening. Our pharmacists intervene and provide education for those lower grades to prevent side effects to becoming more severe. For higher grades, our pharmacists work with oncologists for appropriate actions. This is really a simplified example of numerous interventions and assessments that were completed with a patient with non-small cell lung cancer on Tagrisso, along with a Hmong interpreter. Because the patient was experiencing side effects, the pharmacist increased the frequency and the time with the member. The pharmacist provided common sense strategies and interventions to mitigate adverse events that were determined by the side effect and the protocol associated with the grading. Through Fairview's unique individualized services for the patient receiving chemotherapy in the home, this patient was able to remain safely adherent on Tagrisso. And then, as discussed in the beginning, Fairview Specialty is dedicated to providing quality yet cost-effective specialty medications to patients and the payers. Through each of the disease state examples, I provided examples of how we manage waste and cost. It is really ingrained in our planning and our process. We reduce waste and decrease costs through counseling and educating. We ensure that patients are using the medications appropriately. We ensure appropriateness through a thorough drug utilization review. We promote and support cost-effective medications, including generics and biosimilars. We support patients who may be encouraged to move to more cost-effective sites. Payers can require that a patient be moved from a healthcare administered to self-administered, but the pharmacy has to perform many of the logistics, and that's a full topic in itself. Strict inventory management. evaluation of doses that are outside of the prescribing labels. And if that doses continue to be necessary, we have additional monitoring for those patients. And then finally, specialty pharmacy is constantly changing. Tracking the pipeline is essential, and we proactively adapt our services and our programs based on what's coming to market, based on the new drugs approved, new indications, and new formulations. And I will hand it back off to Nicole.
Alrighty, thanks again, Anne. So as we come to a close, I want to revisit our theme today of that seamless synergy. What Anne has shared has illustrated how our partnership with Fairview Specialty Pharmacy delivers more than just pharmacy services. It's a model that combines clinical precision with compassionate care, ensuring every member receives the right support at the right time in the right way. From reducing unnecessary waste to helping members navigate complex therapies. Our integrated approach is designed to improve outcomes and elevate the member experience all around. This isn't just a strategy, it's a philosophy here at Fairview, and within the four walls of ClearScript, one that's grounded in trust, empathy, and is a shared commitment to doing what's best for the people that we serve. I want to thank Anne again for highlighting some of those great stories that we have within Fairview Specialty Pharmacy. It is wonderful that you were able to put together this presentation and share with our customers as well. I'll throw it back to Randy and we'll open up the floor for some Q&A.
Thank you, Anne and Nicole, for this very informative and compelling presentation. We covered a lot of ground, and now we'd like to open it up for some questions. First of all, we have three main questions that we are normally asked, so I want to cover those three first. So either Anne or Nicole, given the success of disease-specific programs like Rapid 3 for RA and POEM for atopic dermatitis, are there plans to expand similar tools to other therapeutic areas? If so, which ones and why?
That's a simple question. We actually already have a strategic approach by disease state. Whether it's RA, IBD, MS, all of the specialty conditions. So that is already established. And as I mentioned, the other thing we're continually doing is monitoring the pipeline. So we're proactively developing these and assessing disease measures so that we are making sure patients are remaining kind of on effective medication. So we recently added stuff with spontaneous urticaria, COPD. We have numerous disease states that have just become specialty.
Thank you, Anne. Another question we have heard about situations where patients have had automatic refills for specialty medications. Is this useful for the plan or members? How should my plan be structured?
I would say never automatically refill specialty drugs. We've heard situations where patients expire and their kids have to take over their refills and they don't know how to turn them off. And so these are expensive. You want to have judicious dispensing of these medications. I think what you do want to do is work with a pharmacy that makes it easy for patients, such as using their preferred method of communication, using something like Fairview Link, but you don't want drugs shipped. Patients move, patients lose housing. I mean, there are numerous things where that could contribute to significant waste.
Okay. And then the last question I have, the presentation highlighted strategic transitions, like moving asthma therapies to the pharmacy benefit. What were the biggest challenges or lessons learned from that shift, and how are they informing future pipeline changes?
I think the big thing is strong engagement. One of the things that we found is that members want to talk to their providers. And so before any switches occur, so you need to get the physicians on board to begin with. That'll help facilitate transitions. And then it's really important to continue to monitor these patients if they're moving to a new site or moving to self-administered. With the asthma patients, we have a lot of Medicaid patients, and we needed to add a lot of support to handhold them from an adherence standpoint. In some cases, it was insurance barriers, not so much for ClearScript, but there were a lot of changes in Medicaid, but it just exemplifies kind of the importance for once patients move from healthcare administered to self-administered, they do need that extra support.
Well, thank you, Anne. And now I'd like to open it up for any questions. You can put it in our chat and I can read those off for Anne and Nicole. If we do not have enough time to answer your question, feel free to leave your name and email address in case we can get that taken care of and after the webinar. So ask questions if you have any, please. And it doesn't seem like we're going to have any questions. Is there anything else, Anne and Nicole, you would like to say on what you guys just spoke about? Anything more in depth or anything you'd like to share that you didn't speak of?
I'd just like to say for our current clients, if there's anything that piques your interest that came up in today's conversation, there's definitely areas that are happening on your plan, education that your members are receiving through our Fairview specialty partner, and reach out to your account team, ask questions, and we're here to answer those questions, and we're here to help as well, bridge those gaps for members and patients alike. So make sure you ask those questions. Our information will be linked to the bottom of this as well.
Well, thank you, Anne and Nicole, and everyone who attended today. And we hope the presentation was helpful. We'll be sending out a follow-up email with the link to this webinar recording. And then if you could just scan the survey box there, we would love to hear your feedback as it is very useful for us for future webinars. We do produce monthly webinars and podcasts that we post on our website, and you can also find them by following us on LinkedIn. Lastly, if you have any additional questions or any questions that you didn't want or ask here out loud, please don't hesitate to reach out to me. You see my email address, randyskirk@fairview.org. Send me an email and I'd be glad to forward that to Anne or Nicole if I can't answer it. We look forward to seeing you at our next event, and thank you and have a great day.
Thank you.